Good morning. Today on Spotlight, a conversation with the team leading Michigan's COVID-19 defense force in the midst of medical uncertainty, political partisanship, citizen protest, and a Michigan primary right around the corner. Michigan Governor Gretchen Whitmer, Lieutenant Governor Garland Gilchrist II, and Dr. Janae Caldoun, the state's Chief Medical Executive and Chief Deputy Director for the Health and Human Services Department, will be my guests. From their perspective, how is the Great Lakes State navigating these very choppy waters? We'll find out. It's Sunday, August the 2nd. I'm Chuck Stokes, and this is Spotlight. Governor, you just recently came out with some more executive orders. You kind of dialed back on indoor visitation in terms of social distancing. We've got 21 states in the red zone. So we've got that going on. You've got casinos, some restrictions there. So I think the obvious question is, are we winning this COVID-19 battle? Are we losing it? Or are we just barely keeping our head above water?
I think that's a good question. What we know is that we've been really successful at pushing our numbers down. We have saved tens of thousands of lives because of the aggressive actions we've taken, and because the vast majority of people in the state have taken this seriously and done the right thing and are masking up. But we, like other states, are seeing our numbers continue to creep up, and that's precisely why we're trying to tighten things up now in hopes of avoiding having to take steps backwards into phase 3, perhaps. We don't want to shut things down again. The last thing I want to do is issue another stay-home order. I mean, every decision we've made has come with great sacrifice, and I don't want us to have made that sacrifice in vain. I want us to get our kids back in school this fall.
The president is now talking about wearing a mask. That's not something that he said all along, but certainly is the position that he's taking now. What final message do you want to give to the people in terms of the importance of wearing the mask and wearing the mask properly?
So, I mean, we've got study after study that shows, despite the fact that this is still a novel virus for which there's no cure and no vaccine, it's highly contagious, and in a matter of days, the state could heat up like we see what's going on in Florida. The simple, best tool we have is simply wearing a face covering when you leave the house. We should all be doing it. It is about protecting ourselves. There's ample studies that show it protects the wearer, but it also protects everyone around you.
Lieutenant Governor, COVID-19 has affected everyone in some way, shape, or form, but it hasn't affected everyone fairly. That's something that you've been kind of heading up a special task force and keeping a close eye on, particularly coming out of your home seat of the city of Detroit. Are we making progress on that, especially as it affects minorities and people of color?
Well, Chuck, this is a really important issue when it comes to our pandemic response. And we, since the beginning, have been very mindful and intentional about making sure that our response is doing everything we can to deal with these racial disparities. That is why Michigan, in the very beginning, was one of the first states to collect the information about race and ethnicity when it came to infections and deaths. And we reported that out, one of the first 3 states to do so. And what we observed is there were some specific factors that led to this increased risk of infection for Black people and for people of color across the state. One of the kinds of jobs that our community is overrepresented in is frontline workers, whether it's utilities or first responders. And so we put in place workplace protocols to have increased worker protections for people in those roles. The second is some built-in environmental factors. The fact that if you're dependent upon public transportation, whether you're the bus driver or the bus rider, having to get on the bus to get where you need to puts you at greater risk of contracting COVID-19. So we worked with locals to have protocols in place for that and encourage mask wearing for those workers even before we had the full-on masked up Michigan order. And then the third piece is on the environment. When we're looking at, what makes someone more susceptible, it could be literal environmental factors like air pollution in Southwest Detroit and other places. But it's also the fact that, people aren't necessarily connected to the healthcare system. There may not be a doctor in your neighborhood or accessible to you. So it makes it difficult for you to see a doctor and manage your long-term health care.
Governor, last question as it relates to COVID-19. Your state budget hinges on getting money from the federal government. Your budget director has said pretty much all of that. That is being debated as we speak in Washington, D.C., and it has become a very partisan debate. If you do not get the money that you want from Washington, what's Plan B?
So let me start with this. It's not just my budget. It is the budgets of every governor in every state in the nation. We are all grappling with the recession that came as a result of the mishandling of COVID-19 at the national level. We're all doing our best to meet the needs of the people of our states. And that's why, as a bipartisan group of governors, we have prevailed on the U.S. Senate to finish the job that was started in the House and for the president to sign this into law. If they don't get it done, if they fail us on this level, we're going to be in an untenable position where we're going to have to make hard choices around public safety, public health, and public education, arguably the three most important things that we need to be focused on in the midst of a global pandemic. And so it really is necessary that they get the politics out of the conversation in DC and get it done.
Real quick question before we go to the break. The loyal opposition has certainly criticized you over the last few months in terms of your executive orders, said that you've used your power too much so. As you look at what's happening across the rest of the country, particularly what's going on in some of the southern states now, do you feel sort of vindicated from the position that you've taken with your executive orders, or should you have included the legislature more in your decisions?
You know what? Every governor in the nation is grappling with COVID-19, and each of us has had to make choices. The choices that I've had to make were devastating. They were hard. They weighed heavily on me. But 6,000 people in our state died from COVID-19. People are still sick. We see numbers across the state. We're in a stronger position because of the aggressive actions that we took, and because the people of this state took it seriously and did what we needed to do to crush that curve. We've saved tens of thousands of lives. And I can guarantee this, the people of Florida wish their governor would have taken the reins the way that we did here in Michigan. But it's not just me. It's the fact that people across our state did what we needed to do to protect one another. And our economy is going to be stronger because of it. But most importantly, we will have saved tens of thousands of lives. I'm always eager to work with the legislature where we can find common ground. But when it calls on executive decisions swiftly and lives are at stake, I'm never going to apologize for taking the actions that we did. And I'm not going to be bullied into negotiating on things like public health. We got to get it right. And states across the country are envious of where we are now because of the work that we did.
All right. COVID-19 has wreaked havoc with our educational system as well as all the other states across the country. We're going to talk about that right after this break. President of the American Federation of Teachers said the other day that they would support teacher strikes if teachers feel as though they do not have the safety and the resources that they need to bring students back to the classroom safely. Do you support that?
Well, it's understandable that that's the position they're taking. What I do regularly is touch base with constituents who reach out to state government. I don't just call people I agree with either. I listen. I want to make sure that I stay connected. But I had a really profound conversation the other day with a teacher from Portage, Michigan, and she's terrified about going back into the classroom. She teaches a younger grade where kids aren't necessarily required to wear a mask. She's worried that kids coming from all these different families, and you don't know where all the family members have been, might bring COVID into her classroom. And she takes care of her sick parents and also has kids of her own to take care of. And I think that it's a very real concern. As we look around the globe where nations have safely re-engaged school, they only do it where the numbers are dropping and where the numbers have dropped to a very small percentage of COVID-19 positive cases. That's precisely why masking up today so that we can push our numbers down puts us in a stronger position where parents and teachers alike can have confidence that they can get back in the classroom safely. It's all contingent on the actions we take today.
The wealthier districts, a lot of times they have more options, parents, in terms of how they educate their kids. That's not always a choice that can be made in the city of Detroit. What are you hearing from your constituents there, and what is it that teachers are saying they absolutely have to have, as well as the superintendent of schools, to make sure that kids are safe, whether they're in the classroom or it's virtual?
Well, the conversations I'm having are with my fellow Detroit Public Schools Community District parents. You know, I have twin rising second graders in DPSCD, so this is not a theoretical exercise for me, as it isn't for tens of thousands of parents in the city and millions across the state. And what folks are really saying is, they want to make sure that the choices that are being made are collaborative, that school districts are working with their local health departments, that they're working with their education professionals, that they're taking into consideration the hopes and the fears that parents and families have. And as long as those conversations are happening, people are just, really wanting to make sure that it is safe. They're really wanting to make sure that the numbers are going in the right direction, as the governor said. And as we continue to see the uptick, there is an extreme amount of nervousness and tension. People want to make sure that their babies, when they go in, whether they're at the age that needs to wear a mask or not, will have everything they need to be safe. And if we need to do virtual learning, then we have work to do to make sure that kids can be connected to the internet in every district across the state.
Governor Attorney General Barr said that he did not know that your life was threatened. He testified before Congress. Do you believe him?
No.
And are you comfortable with him bringing feds into the city of Detroit? NAACP President Dr. Wendell Anthony said don't fall for the okie doke, and he also said to beware of Trump bearing gifts.
Yeah, so I understand that they have been communicating with the mayor and the chief, and that they are coming in to supplement work with regard to the increase in violence that we've seen throughout the pandemic. I can tell you this, that if that's the case, then like the mayor and the chief, I understand and think that that is a logical extension of what they can do to help the state. However, if this is a ruse to start overhanded exercise like they did in Portland and violation of rights of peaceful protesters, they will not get the thumbs up from me, and we will challenge them. So we'll be watching closely. And, for legitimate purposes, we welcome federal partnership, but where they're overreaching and violating our citizens' rights, we will fight for our citizens.
Former Vice President Biden, now candidate for president, said that he's going to announce his pick as vice president next week. I know you aren't going to answer the question about whether or not you want it or whether or not you may be that pick, but answer this question for me. He has said that it would be a woman. If he changed his mind at the last second and put a male on the ticket, would you be terribly disappointed, and would you still support him?
Yeah, I think that this is a great opportunity to highlight some of the phenomenal women leaders across the country who have been overlooked for a long time. The group that he is talking to, or that we all think he's talking to, let's recognize only Joe Biden knows what he's going to do, is a phenomenally talented group of women leaders. But no matter who Joe Biden's running mate is, I know his message resonates with us, and I will be an enthusiastic supporter no matter who's on that ticket with him.
Lieutenant Governor, I have 20 seconds left. If by chance he picks Governor Whitmer to be his running mate, history would be made in this state, because you would move up to become governor and you would be the first African-American governor. Are you ready for that position should that scenario take place?
I am ready to serve the people of Michigan, and I'm proud to serve alongside Gretchen Whitmer every single day. And we would be looking forward to the opportunity to continue to do the people's business here in Michigan.
August 4th is right around the corner. What do you want to say to the people?
If you got an absentee ballot, turn it in and drop it off. I think that's the best way to get it now at this point, late in the game. And get ready for November. Make sure that you have your application done and that you're going to get one in the mail, because we know that the best, safest way to vote is to vote from home. But if you have to vote in person, wear your mask and be careful, please.
All right. Governor, Lieutenant Governor, thank you so much for joining us today on Spotlight. Always good seeing you. Always good talking to you. Stay healthy. And when we come back, we will talk to the Chief Medical Executive for the state of Michigan. Stay with us. And welcome back to Spotlight. Joining me now in Detroit is Dr. Janae Caldoun. She is the Chief Medical Executive for the state of Michigan, also the Chief Deputy Director of Health and Human Services, the department for the state. How in the world do you get all that on the business card, Doctor?
Well, it's an honor to serve in these roles.
All right, just kidding. Thank you for joining us today on Spotlight. I want to get back to talking about COVID coming out of the interview with the governor and lieutenant governor. As you look at the numbers nationally and you look at the Michigan numbers and you look at people who have died from this. From a medical standpoint, what's your interpretation of the power of this virus?
You know, this is the worst pandemic our world has seen in over 100 years. And so it's something that I don't think it was a surprise. There are many public health experts, infectious disease experts, who knew that something like this would potentially come. No one wanted it to come this soon, but it is something that is something we've never seen before in our lifetimes. And it has unfortunately killed many people across the world, across the United States, and of course, right here in Michigan. So it's definitely the most challenging thing I've ever had to deal with professionally.
But as parents in particular get ready to make that tough decision about whether or not they send their kids back to school, especially if they're going to be in an in-person physical situation, what's the best advice that you can give them to protect themselves, to protect their children, and to protect those that are working, trying to teach our young people?
Yeah, that's a great question. I mean, I also am a mother of three children, and having them out of school has been incredibly challenging. But I think we all understand that we want our numbers to be as low as possible so that our kids can go back to school and stay in school. No one wants to pull them out of in-person learning again for those districts that have chosen to go back in person. The most important thing people can do is follow the public health guidelines. Wear your mask, maintain that social distancing, cleaning, disinfecting frequently used surfaces. Those are the most important things that families can do. And it's not just what happens in the schools, it's also what happens at home. When you're going to the grocery store, going out in public, still, for the parents, they should be wearing their mask, and so should the children.
When you hear about people like Herman Cain passing away, who attended a political rally, did not have his mask on, and you hear people say, and you hear politics get into a situation, you hear people say, I think masks do more harm than good. As a medically trained person, what goes through your mind?
Well, may Mr. Cain rest in peace. Certainly unfortunate to hear of his death. It's unfortunate that things like masks have become political. In the medical profession, we've been wearing masks for quite a long time. We know that it prevents the spread of the disease, it protects our patients, and it protects us. And so we know that masks work, and it's not about what side of the political aisle you're on. It's just about protecting your own health, the health of your family, and the health of your community. And I think, people are starting to catch on. I know the president even was seen wearing a mask and saying that he thought masks were good. And so I applaud that statement. But we really need to have a federal mask mandate because it's really the best public health intervention, one of them that we have to fight COVID, and we don't have very many.
How often have you had that kind of sit down with the governor, you close the door, and she just looks at you and she says, okay, doctor, just give it to me straight from a medical perspective and let me worry about the politics?
Yeah, got very close to the governor and lieutenant governor through all of this. I think, again, I certainly did not expect to be on stage with the governor every week when I took this job. But I tend to be someone who's known to be pretty blunt and to be very clear about what the public health and medical risks are. And I was that way with the governor very early on. And so I think she knew what to expect, and she knew how serious this was and what she might have to recommend as when it comes to executive orders. And I think that she has put science and public health first, and that's why Michigan has done so well with its response to COVID-19.
And real quick question before we go to the break. When you happen to be in the room and politics does come into the conversation, if someone else is advising, okay, Governor, this particular executive order may get this reaction versus that reaction, what happens? Do you leave the room when that happens so that you don't have to deal with that? Or do you like being there to be able to reinforce the medical position for whatever decision the governor ends up making?
Well, I think if you ask folks in the cabinet, I continue bringing forward my public health and medical guidance. That is my role. That is why I was hired. Of course, I recognize that the governor has to think about many things, economics as well, and she has wonderful advisors who are doing that. But I tend to stick to my public health and medical lane and making sure that she has the best data and science in front of her to save as many lives as possible.
Okay, I need to take a real quick break. We'll come back with a real quick question to you to wrap everything up. Stay with us. You have a wide background. You were in Detroit, you were in Baltimore in medical capacities. Graduated the University of Michigan, also the Perelman School of Medicine at the University of Pennsylvania, George Washington University. You've dealt with the hepatitis A crisis. You have also dealt with opioid. From your perspective, how much did that help you in terms of dealing with what you're dealing with right now here in Michigan?
Yeah, I like to think that my previous experiences, whether it's working on public health efforts across the country, I had the opportunity to be a fellow in the Obama administration in the Office of Health Reform. I'm a practicing ER doctor still in Detroit. So I think that, I have many perspectives when it comes to how you fight a public health crisis. And I hope I think it has helped me as far as being able to guide the governor, advise the governor for COVID-19 as well.
Final quick question. Are you optimistic that as a country, as a state, we will lick this problem?
I'm absolutely optimistic. In March and April, Michigan was seeing almost 150 deaths a day, over 1,000 cases per day. We brought that curve down, and we did it not just because of the governor, but because of our local health departments, our state health department, and just everyday Michiganders doing the right thing. And we're starting to see numbers come down again after they ticked up a few weeks ago when we started relaxing some of our public health orders. And so I'm absolutely optimistic. We just need to wear our mask, wash our hands, maintain our distance, and we'll get through this. It is a marathon and not a sprint.
The numbers tend to be increasing among the young.
Yes, that is something that we've been looking at, particularly the 20 to 29-year-old age group. That's been, over the past several weeks, the highest age group as far as rates of new cases. We're working on communicating, engaging with our stakeholders there to make sure they understand that they are not immune to this disease. They can get very, very sick. They can pass it to others who may get sick as well and die. So it is something that we're concerned about. It's something that we're addressing at the state.
Dr. Janae Khaldun, thank you so much for joining us today on Spotlight. I'm sure we'll be talking again, and we appreciate the time that you're taking, and stay safe.
Thank you for having me on. You stay safe as well.
It's our pleasure. And I'm Chuck Stokes. We'll be back next week with more newsmakers in the Spotlight. We hope you have a great week.